Welcome. And we'll get started. So, my name is Shannon, and I'm a registered dietitian specializing in maternal care. Mother of Fact is a telehealth platform providing evidence-based nutrition care from registered dietitians for women from pre-pregnancy and fertility, throughout pregnancy, postpartum, and beyond. We specialize in high-risk nutrition intervention and care and work primarily with birthing people in resource-restricted communities. If you have questions about Mother of Fact, who we are, or how we work with patients and care teams, I'll drop my email in that chat so you can reach out after the webinar. I'm happy to answer any of your questions. Before we get started, a little bit of housekeeping. Please keep your microphone on mute. You're welcome to put any questions into the chat throughout this session, and we'll save some time at the end for the Q&A that Abby, our presenter, will be able to answer all those awesome questions. This webinar is part of our free educational series, and we'll be sharing details about upcoming sessions at the end. And if you can't stay for the full session or want to rewatch and revisit today's content, we always do post our recordings on our YouTube channel. So I'll also send that link in the chat as well. So that said, welcome to today's session. Our topic today is fiber, constipation, and gut health in pregnancy. We're excited to dive into this conversation and share practical, evidence-based guidance you can actually use. So, Abby is our presenter today, and Abby is a registered dietitian specializing in high-risk pregnancies with extensive experience supporting women throughout pregnancy, menopause, diabetes, and weight management, and the treatment of nutrient deficiencies. She's passionate about providing individualized, evidence-based nutrition care that empowers patients to achieve their health goals. Through developing proficiency in Spanish, Abby loves delivering culturally competent nutrition counseling in both English and Spanish-speaking patients, helping ensure accessible, effective, and compassionate care for diverse populations. So, Abby, I'll turn it over to you.
Awesome. Thank you so much, Shannon. I'm really excited to dive into this topic with you all today. Um, like Shannon said, fiber constipation and gut health in pregnancy. Let's get started. So, of course, we should be aware that there's a lot of gut changes that happen during pregnancy. There's a lot changing in the body in general, and this is, of course, a big part of it. It has to do with the hormonal changes, mechanical changes, and lifestyle factors that slow digestion. So we also want to understand constipation, defining it, understanding where it comes from, key symptoms to recognize. And we're going to talk about fiber and gut function. So, the different types of fiber, your daily needs, and how fiber supports your digestion and regularity. So, how important it is basically. Give you some tips on how to get some more in, because we all know that it's hard to do. We will talk about food first strategies. So, we will give you some meal ideas, talk about hydration and your routine, which will be so important. And then we will talk about when to add support. If you're wondering what else I can be doing, we're going to talk about some supplements, magnesium, how to use them, how to go about them safely. So, lots of good things. So, first of all, the gut changes that happen in pregnancy. So, you're kind of aware how and the why behind these things. So, what's driving this constipation in pregnancy? So, a lot of it's hormonal changes. Progesterone is responsible for relaxing the gut muscles. It also slows the gut contraction. So, there's just a lot less of that peristalsis going on, which moves everything through your body. And I've heard it say that this might be because your body also gets some benefits from this because it's able to absorb nutrients better because it's going through your body slowly. There's also mechanical pressure. So, really, the uterus is growing even from day one, and it compresses the intestines. It can slow the stool movement. So, it can not only happen in the first and second trimester, but very much so in the third trimester as well, even postpartum. and supplement related. So a lot of us are recommended that we take iron supplements during pregnancy. That's very beneficial for our body. However, sometimes that is harder on the stomach and it can cause reduced motility, it can harden stool, cause gas, bloating, things like that. And lifestyle shifts. Of course, if you're sick or nauseous or in pain, you're probably going to want to move less. And also, these things can cause a bit of irregular eating patterns as you grow sometimes, that it's harder to eat as much as you did before. And so sometimes these do have an effect on the gut changes. And so sometimes, yeah, this all causes less water to be reabsorbed as well. And so it can cause a harder, drier stool that's more difficult to pass. So that's kind of the why behind everything that's going on in the body during pregnancy to cause these issues. Now we just want to understand constipation, especially because we see this so often during pregnancy, and sometimes it is just unbearable. Sometimes it's just one of the most annoying symptoms of all the symptoms that we get during pregnancy. So, constipation, sometimes people think that if you're not going every single day, then you're constipated. That's definitely not the case. Everybody's body is just a little bit different. So there's no amount that everyone needs to be going every day, every week. We definitely want to make sure at least 3 bowel movements every week is what you're having. If not, then we might talk about constipation. I think it's more also to do with how the stool looks. And that's a good way to tell if you are constipated or not, more than the frequency. If your stools are hard and dry, if you have to strain, it takes you longer, you're feeling incomplete, then those are some really good signs that we are constipated. So, and just so you know, the transit time, stool consistency, and ease of passage are more important. And the goal is efficient elimination. So everything is out at once and not daily frequency. So what is optimal gut function? This is what we're aiming for. Regular bowel movements, you kind of know when to expect them. You don't go a long time without having them. There's a Bristol chart, and so this is a little picture on the side. So we want to aim for numbers 3 to 4. So it should be easy to pass. Anything else, there might be some things going on that we want to take a look at. Minimal bloating or discomfort. This always happens. I mean, very frequently happens during pregnancy, but if it's overwhelming, if it's causing other issues or a lot of discomfort, we definitely want to talk about that. And we don't really want to see really any straining at all. So, um, why we talk about this as dietitians, some people ask why, like this is so important. It really does help us to know what's going on inside of your body. Because if everything is working well, then we know that you're absorbing nutrients, that you have a good gut bacteria balance and reduced inflammation in your body. So everything is tied together, what you eat and how your body digests it and everything. So fiber and gut function. You should probably know, be aware, you probably are, that fiber is so important for our bodies in so many ways, not only energy, but also weight management. And the high fiber foods also have a lot of nutrients. But of course, it definitely helps with stool formation. It adds bulk and it holds onto the water, making stools softer and easier to pass. So it can definitely improve stool consistency. It aids in motility, so it adds the bulk. It stimulates the intestines to contract, keeps everything moving through, and the gut bacteria support. We actually have a lot of bacteria in our gut, some good and some not so good, but the fiber actually feeds the good bacteria in our gut. So it produces protective byproducts and maintains a healthy gut environment. So if those good bacteria are being fed, they're going to multiply. You're going to have more of those. You're going to have less issues in the future. And so it's not going to be an automatic, snap of the fingers fix, but in the long term, it definitely helps. So And then, of course, metabolic support, like I talked a little bit about before, it slows down how quickly the foods, the carbohydrates, sugars are absorbed in your body. So it prevents the spikes and the crashes. So it regulates blood sugar. So if you are worried or dealing with gestational diabetes, fiber is always a go-to to help those symptoms to regulate your blood sugar. Okay, types of fiber. There is two different types of fiber. They're a little bit confusing because they're so similar sometimes. So it's hard to keep them straight, but just so we review it and you're aware of the two different types, there's soluble and insoluble fiber. So soluble, it dissolves in the water and forms a gel in the gut. It softens the stool and retains water, and it slows digestion. So some of the sources of soluble fiber could be like beans, barley, oranges, berries, bananas, carrots, Brussels sprouts, and chia seeds. I don't always think of bananas or oranges having a lot of fiber, but they do in the soluble kind. And then insoluble fiber does not dissolve in the water. It adds bulk to the stool. It stimulates gut contractions and speeds the transit of waste through the intestines. So some sources are whole grains, cauliflower, pears, almonds, walnuts, sunflower seeds, and black beans. So you might ask, which kind do I need more of in my diet, or which one should I focus on? And my answer would be they are both very important. As you can see, they both have different roles, and we need to make sure that we're getting foods from both kinds, the soluble and insoluble. And so there are some foods out there and that have both soluble and insoluble. So these are just so good for you. These includes apples, oats, lentils, chickpeas, broccoli, and flax seeds. So this is so good to know because not everything that has fiber has the insoluble fiber or the soluble fiber. So it is good to be aware of that. So how much fiber do we need a day during pregnancy? And this is also how much we need as a normal person who's not pregnant. So the target intake should be about 25 to 30 grams a day. And I don't know if you've ever tracked your fiber, but this is probably really hard to get. I don't know if I get it myself, and I think we should all be focusing more on fiber. Um, you may actually need more than this if you deal with constipation or you have iron supplementation. So that's a really, really good goal. So this is important because it is important to gradually increase to allow adjustment. If you went from 0 to 30 grams a day of fiber, your body will tell you that they don't love that. It's going to show signs of bloating and maybe even constipation. It's just going to be not used to it. So definitely give your body time over several days and try increasing gradually. So, and this is because the gut bacteria will ferment the fiber, and that can cause the gas production. It's just not used to it, and the gut bacteria they need to grow themselves before they're able to absorb that. Fiber by trimester. You know that the first trimester can be very hard to get in the fiber, and this is often the most important time because it's when a lot of people are dealing with the most bloating, most constipation. So nausea can impact this intake, of course. So we want to focus on the simple, tolerated fibers. Maybe having a list of foods and how much fiber they have in them will help you to realize, oh, this is a safe food, or this is a food that makes me nauseous. So we want to avoid that. We want to make sure it's easy as possible. There's lots and lots of recipes and ideas out there for those struggling with nausea. There are ways to get in fiber besides just eating a salad or something that might make you sick. It really depends on you. So, the second trimester, oftentimes a lot of people are feeling better, not always, but we definitely want to focus more on fiber at that time when the intake becomes easier and start building the consistency. And we want to diversify fiber sources as maybe you're able to tolerate some more foods in there. And of course, the third trimester, we want to focus on that more because um, there's a lot going on in your body, and you definitely want to make sure everything's moving through appropriately. So, there's also, like we talked about, the mechanical pressure of the uterus growing. It can slow the digestion even more, and obviously moving around is harder. So, we definitely want to prioritize the hydrating and gentle fiber. So nothing crazy, and definitely drinking a lot of water through all the trimesters. And so fiber tolerance will change during pregnancy. Your needs don't really change. We would still recommend 25 to 30 grams across all 3 trimesters, but we definitely understand that the tolerance changes between the 3 trimesters. And so flexibility is key. Um, Trying different things and just doing what you can will be very important. So, food first strategies. We want to focus on foods as dietitians because they give us other nutrients besides the fiber that will be very important for mom and baby. And it is easy to go grab a supplement of fiber, but we believe that food always will give you the most benefit. So, the gut support formula, like we always love to talk about as dietitians, is fiber plus protein plus healthy fats. That will build a supportive plate for all of your nutrients that you need for energy and definitely to be able to get that fiber in. So, why this is beneficial is obviously we have that fiber to build up your gut bacteria and improve the stool bulk. And then we have the protein, which also stabilizes and slows digestion. It won't, a snap of the fingers get into your bloodstream right away. And then the healthy fats that supports the lubrication and movement in the gut. So the healthy fats, sometimes if we're not eating any fat at all, it might be hard for things to go through. So, and definitely want to include those healthy fats, but not too much because sometimes they are harder to digest and they take a longer time. And so we want to have them, but not have too much. So these balanced meals can reduce digestive stress and improve regularity. It's been shown that people who eat a balanced meals, a supportive plate like this, have less issues than those who are maybe picking and choosing from one or two of these categories. So we want to get all three at least. Okay, constipation. If you are struggling with constipation and you just need some tips, what can I do? What can I eat? I need help right now. Maybe these are some evidence-based options that we have. So we love chia seeds and flax seeds. You can put them in so many things and they don't have a huge flavor. And so those definitely have a lot of fiber to them and also other nutrients. Kiwi um, helps break down the proteins. It's one of the only fruits out there that has this specific enzyme that helps you to break down protein. So oftentimes I know people that will eat a kiwi or two or three and then have to go right away. So definitely that can be a good option to keep in the back of your mind. And then oats. Oats are usually gentle and easy to tolerate. You can bake them, you can add them to things. They can be flavored and made in a lot of different options. So those definitely are a good option to have. And then lentils and beans, those have good fiber, other nutrients as well, and they can be added to a lot of dishes. Prunes, I think that's the most commonly well known as like a prune juice. It does have a natural osmotic laxative effect. So those are good. They're also very high in water, which helps constipation as well. And then mangoes, they have polyphenols and amylase, which are, they break down food, especially like proteins and carbohydrates. So mangoes also have good properties that will help with constipation. You might try that either fresh or dried. And so a lot of these foods, they not only have the fiber, but they have the water and then they have other compounds that support movement. And a pro tip, definitely don't go all out and just eat a ton of these foods, especially if you're not used to them. Try just going one at a time and adding them in slowly. Okay, hydration. We've talked a little bit about this already, and a lot of people already know that hydration definitely is a huge key in maintaining, a healthy gut and preventing or helping in constipation. When you don't have enough fluids, the stool can become dry and constipation worsens. So generally the target should be 2 to 2.5 liters a day. We can specialize, or we can make that more personal with your weight and your active lifestyle, or, what stage you are in pregnancy, but that's generally the target. One of the best signals is what color your urine is. If it's dark, you definitely need to be drinking more. If it's clear, you're probably good. And a lot of people just also rely on their thirst signals and try to remember to remind themselves to check in with themselves and ask themselves if they are thirsty. So a lot of times your body will tell you if you do need more water. So you can start a day with warm water. Some people like that. You can pair fluids with meals. Try not to just chug a ton of water at the same time. It's a lot better to spread it out throughout the day. Have a water bottle with you or other fluids that you appreciate or like. And you can also try flavoring the waters. Sometimes that makes it more tolerable, especially in the first trimester, to drink water to stay hydrated. So this will definitely help in the long run and also immediately. Other factors to consider is when we're exercising or moving, that definitely helps our gut motility. So sometimes going for a walk, especially right after eating, will help in the long run and also immediately. And yeah, it stimulates intestinal contractions, improves circulation. It helps the body to stay in the rest and digest state, to kind of relax a little bit. If you're always stressed, it's going to be really hard to digest your food. So definitely thinking about that. Even small movement, um, dancing or walking around the room, walking to the furthest bathroom instead of the closest one, parking a little bit farther away, that definitely helps. Prenatal yoga has been shown to help as well, and light daily movement. So instead of sitting all day and then trying to run 3 miles, making sure it's kind of spread out throughout the day, that helps with the gut motility. So your gut does respond to routine. If your body kind of knows what time of the day you usually exercise, what time of the day you usually eat, it makes it easier for your gut to have a routine as well. And so try not to skip meals because that might slow digestion, or eating a really big meal out of the blue, that also might slow digestion and weakens bowel signals. So make sure your meals are regular, you have consistent timing, um, and don't ignore the urge to go. If you feel like you need to go, then listen to that and try your best. And maybe next time it will be easier for your body. Your body will know that you're going to listen. And so, if you ignore it too much, you might not have the urges anymore. So that is when the problems happen. So when to add support? What else can you do if you're already trying to add the fiber? You're pretty sure you're drinking enough water, you're still dealing with this. It does happen. And so fiber supplements are available. If you do have persistent or ongoing constipation, sometimes diet alone is not enough. Sometimes there's just an imbalance. We need something to happen. And definitely talk to your doctor about this before starting any fiber supplements. They do help with increasing stool bulk, holding water in the stool, and improving movement. So there are some options out there like psyllium husk. This is actually in a lot of foods that, they say added fiber. Psyllium husk is an ingredient that will typically be added. And then sun fiber, partially hydrolyzed guar gums are also a type of fiber that will be added to different supplements or other things. And inulin or chicory root fiber. Sometimes it's not tolerated because this is actually a really intense fiber, but it really does work if you're able to tolerate it. So definitely recommend those options. Always start with small amounts. Even if you're desperate, drink enough water for sure, especially the same time that you're taking your fiber supplements, and increase slowly and gradually. So magnesium. Magnesium is crucial. It is actually one of the hardest, I would say. I think a lot of people are deficient in magnesium from what I've seen and what I've studied. It is harder to get in the food that we eat sometimes in our American diet. So magnesium. It helps to pull the water into the stool. It relaxes muscles in the intestines, which is why sometimes you'll be recommended magnesium if you deal with the cramping of the muscles or anything like that, because it does help regulate the muscles and all the contractions that are going on. So there's different types of magnesium if you are looking for a supplement. There's magnesium citrate, which has the stronger effect. This could be used, I would definitely recommend this form for constipation or gut health. And magnesium glycinate, which is better absorbed, gentler, it helps with more relaxation and sleep. So if you need a more absorbable form, like you're deficient in magnesium, I would recommend that. But if you want it for helping with constipation, I would recommend the citrate. So typical dosage. Usually about 200 to 300 milligrams per day, which isn't a ton, and hopefully you are getting at least some from your diet alone. So that's what we would say to start out with. Iron, if you are dealing with constipation, maybe take a look at your iron, your supplement, your prenatal, if it has iron in it, that maybe try taking it out, maybe try going every other day, 3 times a week, something like that. There has been studies that show that it doesn't really affect your iron absorption if you are taking it every single day versus every other day. Your body will still, get what they need, but it might be a little bit better for your gut. It is a battle because the iron is so important, but if it does cause just that, slow down your digestion so much and cause all this constipation, it might, not be worth it. Maybe you're not even absorbing the iron. So getting your gut health back to where it needs to be might be the most beneficial route before you add in the iron. Maybe reducing the iron as well could be beneficial. So maybe you could also adjust the timing. Maybe you take your iron or your prenatal later at night before you go to sleep, or maybe you take it with a meal or without a meal. See if that helps. You can split the doses up. Definitely pairing it with vitamin C helps you to absorb the iron, and so it's not just sitting in your gut. So eating it with a fruit or vegetable, or even making sure that your prenatal does have vitamin C in it. So key takeaways from our discussion today. Fiber is essential for everyone, especially those dealing with irregular bowel movements. It helps the gut bacteria. We want to include a mix of both soluble and insoluble fiber and make sure we're always focusing on it no matter what trimester we're in. Small habits matter. So fiber alone won't be enough. There's fluids, there's movement, there's other like magnesium, there's other things that we can do to improve bowel function. In food first approach, there's a lot of dietary and lifestyle changes that we can do that will help, and these should be introduced gradually and definitely based on your individual tolerance. So remember that supporting your digestion is all about building consistent habits, and small changes have meaningful impact over time, not only through postpartum, but beyond. This will impact your health throughout the rest of your life. So we want to start making good habits. So thank you so much. If you have any questions, we can put them in the chat. Um, yeah, and I think we have some questions that are already coming in, so we'll have Shannon take a look at those.
Great. Thanks, Abby. What a wonderful presentation. I find, fiber constipation such a big topic in pregnancy, postpartum, and even in normal life with every individual. So that was an awesome presentation. Thank you. Yes, we have a couple questions that have come through, but please feel free to put any others in the chat and we'll make sure that Abby can answer them. So to start us off, what should I do if eating higher fiber foods gives me really painful gas? Any suggestions on what to kind of do to navigate that?
Yeah, that's a really good question. I think sometimes a lot of people deal with that. Maybe taking a look at the foods that you are eating. There are foods that are higher in insoluble or soluble fiber, and maybe trying to balance those out a little bit. And definitely going slow. I think that's a big mistake a lot of people make. And we talked a lot about that in this presentation. So hopefully you got that question answered. Just going really slow is important. You can't go from 0 to 100. Your body will not appreciate that. So starting really slow, and And you might be surprised, some foods are pretty high in fiber, and some that you might think are high in fiber maybe aren't. So just taking a look at the foods that you are eating, trying to go slow, trying to add in the water, and that should really help.
Definitely. I totally agree. I think that, slow and steady is best for best results to help with that gas. And a couple of things I've noticed too is some new products that are marketed as high fiber have a lot of fiber, like different like sodas that have some fiber added into them, or different like wraps, like sandwich wraps. They have like 12 to 15 grams of fiber per serving, and that's a big jump. So just kind of being mindful too, anything maybe different packaged products that maybe are different than your norm, trying something else to kind of keep that in mind too, if you're kind of wondering where maybe the high fiber foods are coming from. But love that answer. Another question is if you're picking a probiotic supplement, does the amount of CFU matter and kind of how to navigate choosing the right probiotic?
Yeah, that is a really, really good question. I would say the amount of CFU does not matter. I think that's a big marketing thing. If it has this many, strains of CFU, then it must be better than one that only has 10 or 5. But I wouldn't say that's the case. A lot of them, if they have a huge variety, they don't have very much of anything. They just have a lot of not very much. So, what I would do if I were you and I was, serious about taking a probiotic, definitely talk to your dietitian, talk to your doctor, and look at what your symptoms are, and then look at the strains that might help that. Because there are strains that might help with constipation. There are strains that may help with bloating more. They're kind of studied in different ways. So trying to focus on like good quality strains of CFU instead of amount. That's what I would say. So
Great.
yeah.
Awesome. Wonderful advice. Thank you. Then our third and final question, unless any more come through, is what counts as plant points and how many should I get in my day?
Yeah, that's a really good question too. I think fiber in the media is becoming a huge topic, and along with that is plant points. If you've heard about that, props to you. There was a big study in New England done that showed that people who eat 30 plant points a week have a lot better gut health than those who eat less than 10. So, kind of what the media has taken with that is that we should eat 30 plant points a week at least. And what counts as a plant point, I believe, was part of the question was any fruit or vegetable or whole grain even counts as a plant point. And also little seasonings like spices, if it's not like salt, like ginger or garlic or, onions, those definitely count, but I think they're like a fourth point. So some things are like half point, like garlic or something like that. But if you want like a full point, definitely like an apple or a banana. And so definitely, yeah, because they have all the fiber, they have more water. So I can definitely see that it is true. Like the more plant points, the better. So if that helps you to like count if it's easier to count like track plant points rather than track the grams of fiber, that I think that will be very beneficial for everyone. So.
Yeah, definitely a fun way of trying to, incorporate, looking at, your day to day, your meals and snacks, kind of just overall adding some nutrition. So I think that's really awesome because I have heard too just the variety of having different fruits and vegetables and, using plants to help power all of your
Yes.
gut health. So I like that. It can be a fun way to kind of keep track.
Yeah, for sure.
Perfect. Well, thank you so much, Abby. What a wonderful presentation. Thank you, everyone that has joined us today. So, looking forward to our July webinar. So, that will be Thursday, July 30th at 12 p.m. Eastern Time. The topic will be supplements in pregnancy, what you need and what you don't. So, thanks for coming today, and we hope to see you next month. Take care.
Thank you, everyone.